Visiting with us now is the CEO of Nashville Children's Alliance, Miss June Turner. So nice to have you on the program.
Thank you, Kristen. I appreciate being asked to be here.
Well, it's great to see you. And for the folks out there who don't know the terrific work you all do, tell everybody what the organization does specifically.
We provide services when there are allegations of sexual or severe physical abuse to children. We provide frontline forensic interviews, which are age-appropriate, legally defensible, non-leading interviews of children when there are allegations of severe abuse. And we also provide trauma-informed therapy for children, as well as support groups and other community services.
And you all really work closely with a lot of other organizations, or I should say government services too.
We do. We are an interesting collaboration. We are a private-public partnership. We work every day with the Department of Children's Services, the Metro Police Department, and the Office of the District Attorney General.
All right, great. Tell us, we're talking about a lot of summer month activities and the kids being out and that kind of thing. Some kids, unfortunately, can find themselves in a little bit of trouble. Specifically talking about, you know, child abuse. And that is a very difficult subject for a lot of folks to have a discussion about. You know it all too well, June. So explain to us the prevalence of child abuse here in Tennessee.
Unfortunately, statistics show us that 1 in every 10 children are sexually abused before they reach the age of 18. I think one of the encouraging things, though, is that those stats have actually gone up. It used to be 1 in 7, 1 in 8, now it's 1 in 10, which I think is encouraging and shows us that our prevention efforts and our efforts to educate people are working. Our efforts are being put to good use. Unfortunately, we don't know the number of unreported cases. We only know about the cases that are reported.
That's the thing. You know, some children are very fearful to talk about this kind of situation. How do you have that conversation with your kids, or what should folks out there know who watch children to say, listen, let's talk about this kind of thing in case it ever happens, and who you need to turn to?
I think this is probably one of the most difficult conversations anyone could ever have with a child. And I feel for anyone who has to have that conversation. But if a child comes to you and says, I don't feel good about so-and-so, or I'm afraid, or starts to really disclose to you about abuse, the first thing to do is just remain calm. Let's not frighten the child by our reactions, but to remain calm, believe the child, listen to the child. Don't start questioning the child yourself. Leave that to the professionals, but just listen to what the child has to say to you, and then take action. Report that to the Department of Children's Services. You could be saving a child's life.
For those children who remain tight-lipped or don't feel that comfort in talking about it, as an adult, what kind of signs should we be looking for, June, as far as any kind of child abuse?
And I think that this can be tricky because sometimes there are no signs and everyone is totally shocked, but a lot of times there are some signs. If it's physical abuse, of course, we can look for unexplained injuries. A child who consistently has bruises that don't match a fall from a bike. Or things like that, or a child who's having to be constantly taken to the emergency room. Now, that doesn't mean every child that's taken to the emergency room is abused, but I think we can look for some of those patterns. I think also we can think in terms of changes in the child's behavior, or regressive behavior. Maybe a child that's 5, 7, 8, 9 years old starts bedwetting again, or sucking their thumb, or things like that, that the child is frightened, or the child expresses some fear about not wanting to either go home or not wanting to go to Uncle Joe's house or something like that. And I think a lot of times it's up to us as adults to keep our eyes and ears open and to just be attuned to children, and to believe that it is our job to keep children safe.
Absolutely. You know, it could be a little scary even as an adult to report a case like this, whether it be your own child or someone else's. So what are the proper measures? I know that you said to get a hold of the Department of Children's Services. How do you make that first initial contact? What's important to let them know?
That can be a very difficult call to make, and I think that in the past a lot of us struggled with, do we make this call or not? Is this the best thing to do for this child?
Sure.
Back in 1985, the Tennessee legislature passed cutting-edge legislation in this state about enacting some child abuse laws, and we only have to suspect child abuse to report it. We do not have to be able to prove it. We have to suspect it. And if we suspect it, then we are mandated to report that. And so we call it in. We can remain anonymous if we don't want to give our name. It's best to give our name because then the investigators can follow up with us to get maybe some more details from us. But if we're really fearful, we can remain anonymous. But to give all the details we can, how to contact the child, where the child is, how to get in touch with that child, where to find that child. And then we leave it to the professionals to do the investigation.
Would you ever tell somebody, don't have confrontation or don't try to reach out to the person you may feel is doing abusing to a child? Is that a big no-no? I mean, is that also something that you leave to go to the professionals? What if somebody's that genuinely concerned, doesn't really know, but sees some signs and wants to approach somebody?
And I can totally understand that, and I think if it were my child, I would probably have some of those
reaction, sure.
same
Natural
feelings,
reaction,
and
sure.
I totally understand that. Unfortunately, that is not a wise thing to do. There are a lot of reasons not to approach the alleged offender, and that is something that we totally want to leave to our very able-bodied police department to do. They know how to do it, they know when to do it, they know the questions to ask and not to ask, and we need to leave that to the professionals, even though on a personal level that could be very, very difficult.
Sure. There's a legal obligation, too, for adults to report child abuse, is there not?
Yes, there is. We are mandated by Tennessee law to report if we suspect abuse, not prove it, but if we suspect.
I know you had mentioned that, but I figured we really need to, you know, hit home with that because a lot of people, again, might be a little apprehensive to pick up the phone, but it is a legal obligation. Don't forget that because it's very important. Something I also want to mention is that we know here in Davidson County, that's where you all are set up, but there is an Alliance Center in every county here in the state, correct?
There are child advocacy centers in almost every county. I believe we have about 2 counties where there are not child advocacy centers, but all of Middle Tennessee is covered. And if someone is in another county and they feel a need to get in touch with their local child advocacy center and they're not sure of the name of the child advocacy center, they can either call or go online to the Tennessee chapter of Children's Advocacy Centers, and they have a listing on their website and they can also give you that information.
All right. I know there's so much to talk about regarding the programs that you all have, but if you can just briefly kind of condense them, June, and let folks know what they can expect if they were to ever pick up the phone to call you all.
Sure. Our referrals for our interviews come through the Department of Children's Services or the police department. To have a forensic interview at the Nashville Children's Alliance, the case must have been reported to the proper authorities.
Sure.
And then the authorities will notify us and we will conduct a forensic interview that is videotaped. Okay. So the child is not repeatedly interviewed. And that saves the child a lot being taken from one agency to another agency. We also provide trauma-informed therapy. Our therapists are very well versed in lots of different modalities or ways to conduct effective therapy with children. We only do evidence-informed practices, so we know that they work with children.
Yeah. I mean, a lot of professionals obviously there to help. And,
absolutely.
And I'm so sorry, we're going to wrap things up for now, but June Turner, CEO, thank you so much for spending time with us today.